In this video, I shall try to cover 10 plus queries or doubts that the first timers have when they try to book an appointment with me. First one, how to book an OP. There are two ways to do it. Either you can get in touch with my team in the link Tanmatra Ayurveda. We have an active Instagram page for the same, which goes like Tanmatra Ayurveda. You can either DM out there, my team will get in touch with you and they'll help you with the same. The other one is by writing us in our website. Our website is just coming up. Within a month or two it should be out. You can even reach us out there. The second one is online consultation available? Yes, it is very much available. 80% of our patients are from across the globe, and all of these consultations are happening via online platform like Zoom, and the rest of the conversations are happening via WhatsApp. Third one, how do you avail the medicines? If you are abroad, you can try getting them locally, or you can resource it via your relatives, or you can even ask my team to send it across. We have couriered it to 50 plus countries by now via courier. And if you are within India, again the same. You can either try availing them locally, or we can even send it across, which my team shall help you with. Now, while you are getting these medicines, ensure that you get the medicines of the specific brands that we have mentioned. That is to take care of the efficacy, to ensure that the herb which I am looking for your specific condition is there in the medicine, and also to ensure that they are free of heavy metal toxicity and excessive preservatives. What happens with most of the Ayurvedic medicines is that they are quite packed with preservatives. Now, so as to avoid the complications from the same, I am quite choosy when it comes to medicines. Most of these medicines are classical preparations, and therefore it should be quite easily available. So during the hour-long consultation, after analyzing the difficulties being faced at the mental, physical and cognitive plane, we try to understand the status of the gut health, and that is done with the help of Ashtasthana Pariksha. And after that, we try to understand the sequence of events that has happened from the time the issues have begun and then to what is the current status of your disease. Depending on these factors, we try to understand the current status of pathophysiological changes that has happened in your body with respect to the three doshas, the tissues, shrotas, and then we try to understand how to go about with the case. Depending on this, the prescription is made, followed by the dietary and lifestyle modification chart is also created specific to each one individual. The fourth question, is it Nadi Pariksha essential to identify the condition Ayurvedically? Well, no. Nadi Pariksha is just one of the Ashtasthana Parikshas, as in one of the 8 measures of examining the body. So as long as you have 7 others open to you, the 8th one doesn't matter. Without the Nadi Pariksha itself, we are able to treat, reverse and even manage the chronic conditions quite effectively, even if it be online consultation. The other common doubt that most people have are, is there a Ayurvedic substitute for the synthetic Thyronorm pill that is given for the treatment of hypothyroidism or Hashimoto's thyroiditis? Well, let me tell you, the Ayurvedic way of managing the condition is quite different from what you may think of. Ayurvedically, we need to understand what exactly is happening inside your body. We are not concerned just about the thyroid gland. We need to understand what is the status of your health with respect to gut, then whole body, the thyroid gland, whether there is an inflammation or whether there is a condition called avarna. Depending on the status of each one of these, first we need to go for cleansing therapy or anti-inflammatory management, then we need to do a gut reboot, then stabilize the 3 doshas, then go for a rejuvenative management. And it is through this 3 to 4 steps of management that we try to treat your thyroid dysfunction. How long can it take for the treatment of thyroid dysfunction? It can go on from anywhere between 1 month to 6 months or 1 year, depending on the chronicity of your condition. Say for example, if you have been having it for 10 plus years or 20 plus years, then chances are that the condition must have affected almost all parts of your body. In that case, it has become krichrasadya or yapya, which means tough to be treated. But that doesn't mean that there is no treatment for the same. your condition can be made much better. In almost all conditions, we are able to give approximately 85% relief. Now, what are the benefits of opting for Ayurvedic management for thyroid dysfunction? While popping in a pill is very easy to do, there are also many complications that a body goes through. And that is when people start opting for alternative measures. So, what are the advantages of Ayurvedic medication? The fact is, you become almost normal with respect to the physical health, mental health, and cognitive health. It is in fact possible to get your old self back. These may take time, but in any case, these milestones are reached for sure, and it's just a matter of time. What is the success rate? 8 out of 10 patients are definitely better, and they have got a much better quality of life, be it mentally, physically, or cognitively. In 6 out of 10 patients, it is getting reversed and cured, and for the others, it is getting quite well managed with the help of some or the other form of mild Ayurvedic medicines. What about tapering or weaning of the medicines? We do not remove the synthetic Thyronorm pill right away. Rather, we try to understand what is the status or how far the body is able to function with or without the help of synthetic Thyronorm pills. And depending on that, we either remove it completely if the body is quite able to help itself out. If not, we try to eventually wean it out by building the health of the body. What are the components of Ayurvedic management? It is not just about popping in a pill, rather it is about correcting your lifestyle, wherein we teach you how to live in tandem with the nature. Second, food habits. We are what we eat. Every inch of our body and mind are made out of the food that we consume, and therefore food plays more than 50% of the treatment. We help you to identify which are the best foods for you, and it is not just mere lactose-free, gluten-free diet, but it is about identifying what is the status of your gut and tridoshas and then decide what is best suitable to you. In any case, it will be staple form of diet which is easy to digest. And as and when your health gets better, we will be reintroducing the rest of the foods that your body is used to. And the third and the most important component, it is not the same Ayurvedic medicine for everybody. That again depends on whether your Vata is spiked, Pitta is spiked, or Kapha is spiked. Or is it because of inflammation that you are feeling so unwell? Depending on the status of these 4 factors, we will be deciding the course of management. And what happens once the Ayurvedic management is done? 1. The synthetic Thyronorm pills are either completely weaned out eventually, or we maintain a mild dose of the same until the body is able to function without itself. 2. You got to live in tandem with the nature. 3. You got to eat healthy foods. We will be teaching you, we will be guiding you in understanding what is the best food for you, and there won't be any more love-hate relationship between you and your food. Very often what we get to hear the patient saying is that within 3 to 6 weeks of treatment, they know what exactly doesn't suit their gut or their body and what exactly sits well with their system. And this kind of intuitive eating itself is the first step towards treatment. In my practice, that one factor or that one shloka that I hold close by my heart while treating any patient is the one that you get to see here. And as per the shloka, as long as these factors are attained, you are healthy. And the TSH gets stabilized with time once your health is reset. So while treating any thyroid dysfunction, that one shloka that I keep close to my heart is the one that you get to see out here. And as per the shloka, a person is said to be healthy, or the focus of our treatment, aim of our treatment is always what you see out here. Samadosha, wherein the body is in a state of harmony, a balance of all the 3 doshas, wherein you do not feel any kind of discomfort. Samadosha Samagnishta, wherein you have a stable appetite, wherein the appetite is not too deranged, it's neither hyper nor erratic. So if you have a stable appetite, it means that you have reached a state of health. Samadosha Samagnisha Samadhatu, when all the tissues and organs are in proper shape and are functioning well. Samadhatu Malakriya, wherein the bowel, urination and sweating are in a state of health, as in you have proper daily regular bowel evacuation, regular urination without any itching or burning, and wherein you have a smell-less or odorless sweat. That is also an indicator of your status of health. And once you have attained these 4 factors, the 5th and the most important one, wherein your soul, Atma, mind, and your sense organs are in a state of prasanna or happy. So if you have attained all these 8 factors, then you are healthy. And this is the one shloka that I always follow while treating my patients.